well, we are in the flu season, so that is expected that you're going to have a spike across the country. So what we normally do is we ascertain and plug in all the data that we normally have and be able to compare it with other years. That's what the epidemiology unit is doing today with the data from Karl Heusner, because usually the data is sent to us on a manual basis, not on an electronic basis. So as I said, when you compare it with other years, the other areas in the country have not had a spike. We are also trying to find out if the patients that Karl Heusner are seeing are being referred from somewhere else, because that could be a reason why they're seeing an increase in number and we are not seeing it elsewhere. But it is expected that you're going to have spikes usually in November, December in terms of the total number of acute respiratory illnesses. Hand washing and the usual cough etiquette is what is usually stressed around these times. Also avoiding going to areas, especially if you're at work when you have lots of people that you're going to be in contact with. Also, if the flu symptoms are getting progressively worse, or after 3-4 days you are not getting any better, before you start also medicating, you should seek medical advice. We also know that there's a tendency for people to use antibiotics, but in most cases of the flu, it's usually viral infection, so antibiotics will not really help. Drinking lots of fluid, bed rest, those are the cardinal messages we need to be able to get across to people. We will be updating everybody once we are able to gather more information to see if this is any outbreak outside of the norm, and try to determine what is the cause of this agent. We did go back and review our data at Central Medical Lab, and it's an RSV virus that's usually the common cause of flu every year. That's the one that the strain that we have been able to ascertain is the one that seems to be circulating now. So it isn't anything out of the norm.